Hi, I'm Leigh Vanderloo, and I am in my first year of my master's in the field of health promotion. And so my area of study is looking at the preschooler physical activity behaviors of preschoolers and how the environment will influence their physical activity patterns. And so specifically for my thesis, I hope to look at how the childcare environment looks at their physical activity patterns. And so just a little bit, I guess, on how I stumbled into this area. I was very fortunate that about 2 years ago, so right before I entered my last year of my undergraduate degree, I was able to work as a research assistant to Dr. Trish Tucker. And I think that was just the first, I guess, opportunity that really opened my eyes in terms of what research is all about, because everything up until that point was just really book related and lecture. So it was really nice to get some hands-on experience. And what was great was the first study I assisted her on was actually some focus groups that her and her research team were conducting with the childcare providers at these childcare centers. And while I greatly appreciated being able to see just how vested Dr. Tucker and her team were in their project, what really inspired me was just how dedicated the childcare staff were to the children in their care, seeing how much they really wanted to create a healthy and really fostering environment for the kids under their care really inspired me to continue in this area of research. And so quickly, I just hope to kind of give you a little snapshot on what I hope to look at for my project. So a little bit of a background. It's not unknown that childhood obesity is a major public health concern, not only in Canada, but on an international scale as well. We know from the literature that one of the avenues for combating this chronic disease is with physical activity. However, what's a little disappointing is despite all the known health benefits of physical activity, there's currently a low level of regular physical activity participation by children, including preschool age children, which are children between the ages of 2.5 and 5. And so just to kind of give you an idea of how low it is, during the week, on an average day, they might only engage in up to between 20 and 25 minutes of physical activity per day during the week, and maybe up to 32 minutes a day over the weekend, so either a Saturday or Sunday. And these levels are quite dismal considering that the National Association of Sport and Physical Education recommends that children of the preschool age should engage in about 120 minutes a day. So there is quite a huge difference. And so looking a little bit more at the childcare environment, the 2010 Active Healthy Kids report card, which was published by Healthy Active Kids Canada, which is, I guess, just they synthesize a bunch of research relating to the health of children and physical activity, identified the childcare environment as an ideal venue to intervene with this population. And some of the reasons that we can find in support of this is that we know that many Canadian preschoolers do attend childcare, so a little over 54%. And those that do attend are spending a lot of time in childcare. They're also spending, because of how many hours they're spending in the care, they're going to be learning many lessons and establishing behaviors, not the least of which are those related to screen viewing behaviors, nutrition, and physical activity. And one of the points that I think is the most salient, at least to me, is that research has shown the childcare environment to account for almost 50% of the variation in childcare or in preschooler physical activity, which is huge considering gender and ethnicity don't even account for that much. So I think that just kind of lends some support to why it's an important area to investigate. And currently in Canada, there's still a lack of literature and scholarly attention to the preschooler population. So again, some more rationale is that we know that low levels of physical activity predict future pediatric obesity and overweight. From a health promotion perspective, this is really important for me because it means we want to ensure that these children are developing early physical activity behaviors early in life, coupled with the fact that there's a current need for Canadian data on preschooler physical activity behavior, I think sets the stage for my study. And so with that said, my proposed purpose is threefold. The first is that I hope that we could assess which attributes within the childcare environment influence physical activity, so whether that be the staff behavior, how much indoor-outdoor space they have, the equipment that they have available to them, so whether it be jungle gyms, balls, hula hoops, Second is to compare the physical activity levels of children attending different types of childcare facilities, so home-based versus center-based. And then thirdly, to compare the preschoolers' physical activity levels to the NASP guidelines, which I mentioned before, were the 120 minutes of physical activity per day. Okay, so with regards to data collection, we will be following a cross-sectional design, and that will be recruiting 12 home-based and 4 center-based childcare facilities in London. And the reason for the difference is just because of the number of children that attend each facility. Much fewer children attend home-based versus the center-based ones. We'll be using 2 tools to help us collect this data. So the first one is the Environment and Policy Assessment Observation tool. And this really includes a document review of each of the participating childcare facilities' physical activity policies, as well as a day-long inventory of each of the childcare's environment. So that would be me going in for the full day and just recording, observing different things like what equipment they have available to them, how many minutes of active play they're engaging in. And then the second, in order for us to help objectively measure the physical activity levels of the children, we'll be having the kids wear accelerometers, and that's a picture of one of them. So they're just really small motion, like omnidirectional devices that the kids will be wearing on their waist while they're in the child care center for the day for 5 days. And this is going to help us see exactly how active they are, how many minutes they're spending in sedentary versus moderate to vigorous activity. Okay, and just briefly on the data analysis. In order to answer the questions, we'll be running our data through SPSS. And so to answer our first question, we'll most likely be running regression analyses in order to establish which attributes within the childcare facility predict physical activity. So is it the presence of equipment, the presence of a lot of outdoor space, indoor space, etc. To answer the second, we'll be running independent sample t-tests, and this will help us determine whether the activity levels differ for children attending home versus center-based. And then thirdly, we'll run simple frequencies to see exactly how many children are actually meeting the NASP guidelines. So just before I finish up, some possible or future implications of my study could be that it'll highlight the necessary changes that need to happen within the child care facility or child care policies that better support physical activity. Second could be that it could highlight the variations in activity levels that exist between the different types of childcare facilities, so home versus center. And then as a final, more overarching implication with that, it would just set the stage for other future research in this field. So with that said, that's the end. So thank you.